Thank you, medical student Dylan O'Shea and Dr. Heather Evans, for talking to us today about the research you've done together. What is the research you've done together?
Well, thanks so much for having us. What we're working on started about 2 years ago when I got Google Glass for the first time and was very excited about using it in the operating room as a tool to help surgeons see new procedures, learn new procedures, and get feedback on their performance. And so we started this study about a year ago, and I'm going to let Dylan actually talk about what we did. But just in general, we were looking at the performance of a specific procedural task, recording that performance using Google Glass, and comparing that performance and how we can rate it with a third-person video point of view.
Excellent. So trying out new technologies in the operating room and studying them. Fantastic. And you guys are going to talk about this at the ASE conference coming up in Seattle, right?
Yep, right here in Seattle.
All right.
So what we were trying to do was we were looking at the placement of an IJ line, a central line, and trying to see if we have a third-person video and a Google Glass first-person video, which one of these provides us more reliable data. If we have people look at the video after the fact, which one will allow us to rate the procedural skill of the practitioner better. So we took video both from the Google Glass and from a third-person perspective of medical students, residents, and attendings performing the IJ line on a mannequin. And then after the fact, we looked at which of these are more consistent. Do we get more consistent ratings using the first-person view from Google Glass or just from your standard third-person view?
Was the third-person view a stationary camera?
It was actually a camera on the head of one of our techs, usually me. So basically to try and simulate somebody just standing there watching,
Right.
because that's what we're trying to replace.
Okay, and you found out what?
Well, we actually found that it was not as good using Google Glass. For a couple of the steps of the checklist that we had, did you perform this procedure, did you do that? For a couple, it was a little bit better, but overall, across the board, the third-person video was much more reliable, and our raters after the fact found that their ratings were much more consistent.
Okay, so some negative research, fantastic. I'd like to see some published negative research. It's great to hear that you're doing some, doing some innovation in the operating room, and particularly that you're studying it. Does this mean the end of Google Glass, Dr. Evans?
Well, actually,
for doctors?
I don't think it's the end at all. I think this is just the beginning. I think it's very important to evaluate new technology as it comes out in a safe environment so that we can understand how we can best use it. I think Dylan did mention that there were some aspects of the procedure that were better seen using Google Glass. And I think that in the future, what we're going to find is that this is just another adjunct. Wearables are not going to be the end-all, be-all solution. They're going to be part of the solution for learning and training and giving feedback to practitioners. This is only one aspect of what Google Glass can do and other wearables can do. We were just using it as a video recording, and we didn't even explore some of the other more advanced functions that the device can do.
Will you be studying?
So I think,
will you be studying it in other circumstances?
Well, I think we're really interested in doing that. I'm going to be a part of an international meeting in April this year later on, and hopefully going to be doing a live operation where we're going to be transmitting video both via laparoscopy and via Google Glass. So I think there are some really exciting developments coming down the pike, and now that Google is focusing much more on professional development of the device instead of just broad commercial development, I think there's a lot more for Google Glass in the future.
Good. So we look forward to seeing you in your own hometown. When is the conference? Do you have the date on the tip of your tongue? Thanks for checking out the Op Report. Help us keep conversations alive on topics in general surgery. Check out more episodes of the Op Report and other OnSurge content here at YouTube. Find us at Facebook, follow us on Twitter, and find our homepage at onsurge.com. Join the conversation and tell us what topics you'd like to hear about and what people you'd like to hear from.